Welcome to Parasitic Diseases. Today's topic is hookworms, Ancylostomum duodenale and Necator americanus. As I mentioned earlier in the Trichuris and Ascaris presentations, there are three worms that, when collectively thought about, occupy essentially the same geographic distribution throughout the world. That's Trichuris, of course, Ascaris, and today we're going to discuss that third worm, hookworm. Together, they are often referred to as the unholy trinity. You'll notice that for the first two, Trichuris and Ascaris, which were reproduced from the earlier presentations, to show you by side-by-side comparison to where hookworm is shown, the WHO, in their infinite wisdom, could not decide the differences between the distribution of Trichuris and Ascaris, and so all they did was reproduce the same map twice and say, as far as we know, the distribution for Trichuris and Ascaris overlaps so well that the map would never show those small differences. The same is not true, however, for the distribution of hookworms. So hookworms, those two species that I mentioned early on, Necator americanus and Ancylostomum duodenale, have distributions that are skewed compared to the two other geohelminths. But as we will see, they all affect large numbers of people. It's interesting to look at how this worm was discovered, because part of the discovery led to a control measure, which is still in place today. And without hookworm being the poster child for the reason why the American South did not recover after the Civil War, we may never have discovered this simple intervention strategy until much later on in our history. So we can blame hookworm for a lot of diseases, but we can also credit hookworm for allowing us to discover a control measure which, when implemented, controlled many other infections as well. And all we're really talking about is transmission of diseases by the fecal-oral route. So to begin with, Anthony Dubini was credited with the discovery of the adult worm in patients which he saw back in the 1840s. And he made the assumption that this parasite probably causes disease as well. And he published a seminal paper on this, as noted at the bottom of the slide right over here. 1843 is an important date to keep in mind. So why am I showing the development of the St. Gothard's Tunnel? The St. Gothard's Tunnel was built in 1880, and it was a very difficult drilling. As you can see over here, where it goes and where it ends is about, it's 15 kilometers, it says so right here. Imagine working in this tunnel as a worker and then having to defecate. The first mile of the tunnel, maybe you would be tempted to walk outside and deposit your feces in a place that doesn't offend anybody else. But when you got into the second mile of the tunnel or the third mile of the tunnel, the walk out would exceed the length of time that you worked inside the tunnel. So the workers began defecation inside the tunnel. At the same time, of course, the rough edges of the stone that they were creating by blasting their way through solid rock made wearing shoes problematic, because the shoe soles began to wear out very fast. And in around just a little bit before 1880, they noticed that the death rate among workers began to increase as the depth of the tunnel was achieved. And so some bright person discovered this Italian physician's work, published in 1843, describing the possibility that diarrheal disease, followed by frank blood in the stool, so therefore it would be dysentery, may be linked to a parasite, which Dr. Dubini may be able to help us with. And they called him in as an expert witness, and he suggested looking in the stools of the discarded fecal matter inside the tunnel, and sure enough, they discovered the larvae, and on some of the victims, Dr. Dubini performed autopsies and made the conclusion, the astounding conclusion, that not only does hookworm cause disease, but it can also cause mortality as well. So he became famous for his publications. And we'll see later on why that's important to notice. At a much later date, back in the 1890s now, Arthur Loos, being one of the students of Rudolf Leuckart, was stationed in Egypt because Egypt was looked at as a gold mine for discovery of new parasites. And even though Dubini had discovered the adult stage of Encelostoma duodenale and made the connection between disease and mortality, nothing was known about the life cycle. It still wasn't sure as to how we acquired this infection. And Arthur Loos's job, Leuckart commissioned him to go to Egypt where hookworm was endemic and to discover for himself the life cycle of hookworm. And so he began to set up animal experiments as a way of obviating the need for human patients, because obviously he wasn't a physician, he was a PhD student. And in the course of collecting fecal samples from around Cairo and then making sure that they had the larvae, they were sure at that point that this had a larval stage to it. But they couldn't make the connection between the larva and how it gained entrance into the human body. So one day while he was trying to infect his guinea pigs, he accidentally spilled some of that fluid containing the larvae onto his own hand, and then continued to infect the guinea pigs orally. And about 2 days later, he noticed that his hand began to itch at the spot where the water containing the larvae had touched, and made a leap of faith conclusion that, aha, perhaps these worms can penetrate the unbroken skin. And sure enough, sometime later on in this infection, which was initiated by himself, he was able to isolate eggs from parasites that resulted from that infection that had located into his small intestine. He didn't infect himself with a great number of worms, so it didn't really endanger his life. But what it did was it completed this interesting story of, okay, here's a lot of hookworm infection. How do these people catch it? How do they spread it? So when it became obvious that human feces was the agent through which this disease is transmitted, then it became obvious that controlling the spread of human feces was very important in terms of sanitation. And that's where our story picks up, not in the old world anymore, but rather in the United States of America. We had a civil war that lasted 4 years. And during that time, many, many people died on both sides of the Confederacy and the United States Union armies. Both died from malaria, they died from dysentery, and they often died, in this case, from hookworm infection. It remained below the horizon, though, as to what they were dying from. And indeed, what one theory suggested as the reason why the South actually lost the Civil War was because they were forced to use deerskin for their leather rather than cowhide, which was de rigueur for those living in the Northeast, because that's where the shoe industry was. So a thick leather sole on a boot would prevent the penetration of the skin through the sole of the feet by hookworm, whereas if you were wearing deerskin shoes, even though you were a little bit quieter when you were sneaking up on the enemy, the fact is that deerskin is very friable and eventually wears thin, enough so that it might expose skin, and enough so that it might also allow the larvae of hookworms to penetrate through the skin and create disease. Well, that theory was developed only much later when it was discovered that the post-Civil War recovery was very, very slow. And they were perplexed as to why that was true. All of the slaves had been converted to now African-American citizens, and most of them headed into the woods to fend for themselves when they were freed from their slave owners. And the slave owners sat on their porches and wondered where they had gone wrong. Of course, there were lots of answers for that question. The point is, though, that they appeared to be lazy. For some reason, they weren't reindustrializing the South using other technologies. They were just sitting there, sort of biding their time, chewing on the fat, so to speak, and talking about the old days. And the northern visitors to the South during the winter months, when they would vacation in Florida, would pass by these communities and see large collections of people sort of just sitting around doing nothing. And it became the phrase of the day, so to speak, Southern laziness. They accused the South of just being lazy. They just didn't want to work after the war. I don't care what happens. I'm just going to live out the rest of my days, and that's the end of that. Well, there were some other people that were not as enamored with that hypothesis as the lazy camp of hypothesizers, I should say. One of the people that really wanted the South to recover, of course, were the industrialists. One of them in particular, John D. Rockefeller. He had become an oil baron, of course, over the course of time. Oil is a commodity that needs to be sold to generate energy for propelling individual vehicles, tractors, trains, et cetera, et cetera. And that market didn't appear to be growing as fast as he wanted it. And so he commissioned a Rockefeller group of people, handpicked by Rockefeller, to go down into the South to find out why these people are so lazy. And one of those people was Charles Wardell Stiles, who emerged as one of the heroes in terms of describing the role of hookworm in creating Southern lazy people, which turned out to be not from laziness after all, but rather these people were anemic, and the anemia was being caused not by malaria, as might have been suspected because malaria was still endemic in the United States, but it was seasonal. And the anemia from malaria is rather transitory, whereas the anemia created by hookworm can last for years, and there is no seasonality to it. Once you've got it and you don't get treated, it will be with you. And Stiles was sharp enough to make that connection and to come back and say, look, here's this paper by Dubini that shows that patients with hookworm infection get sick, they're anemic, they have dysentery, and they sometimes die. And I think we should pay attention to this seminal publication and apply it to our own situation. And of course, the question was that where did all this come from? If hookworm is in the United States, how did it get here? And the answer was actually quite simple. It was brought here from Africa by the slaves themselves. So how ironic it might be, if history turns out to be correct in this, that African slaves brought hookworm with them, contaminated the South with the worm itself because the lack of sanitation was rampant. The white slave owners eventually acquired the infections. Everybody that participated in the Civil War from the South was susceptible to the infection because of the lack of proper boots, which seems like a triviality, but in fact, it turns out to be, it does hold some validity in terms of the argument. At least it was partially true, if not altogether true. And by realizing this, a strategy for control was devised. Because what was found by looking at the biology of these worms is that they can only migrate about 4 feet from the area of deposit where the feces is. So doing that experiment said, well, if the worm can only migrate 4 feet, how does this help us in terms of controlling this infection? Because if we can control this infection, we can allow the South to recover and revitalize itself, because right now it's being hampered by this crippling disease. And so an ingenious set of experiments were conducted with various depths of holes in the ground. Feces contaminated with hookworm larvae were thrown into each hole. And it was shown that you're absolutely right. These worms will only migrate up to the 4-foot mark of a hole that's perhaps 5 or 6 or 7 feet deep. And by covering it over and putting a place to sit inside this structure to allow the feces to free fall its way down into the bottom of what was to be known as the pit priffy, we invented the outhouse. And this outhouse, although there were other versions throughout the world, humanity is famous for reinventing the wheel, and indeed we had to reinvent this wheel in this country, and we structured it in such a way as to make it socially acceptable. There were instances where the privy was not accepted by people because the tradition was to defecate someplace outside. And so they used reverse psychology in some cases to say, well, in that case, we're only going to allow the mayor of your town and his immediate family access to this privy because their health is more important than yours. And of course, this caused people to react in the opposite direction. No, we want one also. So they overcame resistance to A, wearing shoes, B, defecating in a specific spot rather than wherever you please. And as a result of that, plus urbanization and the advent of modern industrialization, the South indeed did recover. And today we have sterling examples of outhouses throughout the world. And it's the camper's best friend, and it's everybody else's best friend too, because it sequesters organisms in a place that they can't escape from. It's like putting them in prison. And this popular way of sanitizing this country enabled us to avoid infections or big outbreaks of, let's say, salmonellosis. Other diseases that related to Giardia, for instance, and to Ascaris and to Trichuris, all those geohelminths that we just talked about, they were all kept at the bottom of this pit. And from that point on, of course, as they would say, the rest is history. We improved on the design, we urbanized it and turned it into flush toilets, which, by the way, just as a noted added proof here, everyone credits Joseph Crapper with the invention of the flush toilet, but that's actually not true. A man by the name of Harrington invented it back in 1596, but it wasn't applied generally to the population until royalty got a hold of the idea and said, well, we should have these because this is the only sanitary way to proceed. So what did Loos and all the hookworm experts of their day notice about this infection that attracted them and kept them engaged throughout most of their research lives? Because this worm is fascinating in other ways too. They're both males and females, and you can see here Loos's original drawings that he made from adult worms that he recovered from patients that physicians brought him from Egypt. And they are elegant drawings that they're still valid today. All the structures are as they should be, and he drew them exactly as they were. So he was a remarkable, technically detailed parasite biologist, and we owe a great deal of debt to his work and the amount of time that he put into this to tell us exactly what's going on today. Loos's elegant drawings of the adults of Ancylostoma duodenale are shown next to an actual picture of one of those stages. In this case, the female worm is shown, and you can tell it's a female worm because the male actually has a little clasper device over here at its tail, which it uses to grab onto the female with in order for him to be able to insert sperm so that the eggs in the female can be fertilized. And here is that structure. It's known as a bursa, and it's specific to hookworms and to others in that same group. And you can see up here is the head. Now, what do these parasites look like up close? They're actually frightening. Here's a picture of the oral cavity of Ancylostoma duodenale, and it's got teeth. You can actually see these cutting teeth here with two little plates down over here. This is the oral cavity, and this is the head of that worm. And this worm has the capacity for sucking large volumes of blood, and as we'll see how it carries out its biology. As compared to Necator americanus, it's less intimidating perhaps in some regards. It's got cutting plates rather than teeth. But nonetheless, it's able to do the job quite well. Thank you very much. The life cycle of hookworm is as follows, and it reflects some portion of the Ascaris migratory life cycle. So we can make some connections now between a worm that we've already discussed and Necator americanus. The Necator americanus and Ancylostoma duodenale have almost identical life cycles, so we're using Necator as our worm of choice, so to speak, when we talk about hookworms. So the entrance of the parasite into the host is a unique entry point. This is not a usual place for parasites to gain entrance into hosts. It's most likely through an oral route. A vector brings it to a surface like skin, or it defecates on the skin and we rub it into our eye, as in the case of Trypanosoma cruzi. But But here we have an instance of a parasite which obviates all of the known barriers for protecting us against external things like infections and noxious materials. This worm has the capacity to not only cling to our skin when we brush up against a collection of larvae, as you see illustrated here. This is not just one worm on this little blade of grass. We have hundreds of worms here, and they're all with their head ends pointing up, and they're waving sort of back and forth like a flame in the wind. And this behavior is called questing. And indeed, they're questing for a host. And I should also mention now that neither Necator americanus nor Encelastoma duodenale can infect any other animal except humans. So we brush up against these blades of grass, which of course happen to be where a deposit of feces with the eggs initiated the larvae to hatch. I'm jumping a little bit ahead of the story here because we have to return to that in a moment. And the larvae then are deposited on the skin by accident. They're small enough so we couldn't see them. And the worms crawl along the skin until they encounter a hair shaft, and they migrate down along the skin of the hair shaft until they get to the very bottom. And that's where the blood supply for this root, for this hair, initiates. And this worm then penetrates into the capillary. And once it's in the blood, it imitates the life cycle of Ascaris. It's pumped throughout the body. It eventually ends up back in the alveoli of the lungs, just like Ascaris. It then migrates up the trachea till it gets to the epiglottis, and at that point, it's now swallowed. By this time, it's a fourth stage worm. The infectious stage of this parasite is the third stage larva. So it's swallowed, and it's now a fourth stage worm. It undergoes one more molt and develops to an immature adult. Now, it takes about 2 months for the worms to mate and for the females to start shedding eggs. But in the meantime, of course, they need to eat. And what do they eat? They eat villus tissue. That is their food. So they're eating a big chunk of us. And in addition to that, as we'll see, the worm actually sucks blood. What they're doing with that portion of their offense to us in terms of pathology is not well understood. We're not sure what the role of blood sucking is fulfilling for the parasite. We know what it does to us, however. And we'll come to that when we talked about the clinical infection. But to complete the life cycle, the eggs are then passed, and now we have lots of eggs being passed. And with Trichuris, we had 3,000 to 5,000 eggs. We have 6,000 to 8,000 eggs for hookworm. We've got 200,000 eggs for Ascaris. So you can understand how the environment is just being filled up with all of these infectious stages for people. And that's why the geographic distribution for these parasites is so extensive. The eggs develop rather rapidly. Within a week, the larva inside develops and hatches in the soil and begins feeding on the bacteria which are present in the feces. They then grow to the second stage. The second stage then molts to the third stage, and the third stage, referred to as a filariform larva based on its shape, is the stage which does no longer feed, but rather sits at the highest point in its environment, and it waits for a host. Now, this occurs every day, but you obviously know that in the South, for instance, where this was an endemic infection at one point, it gets warm during the daytime. And the moisture that's created by weather reaching the dew point every night, shedding a moisture on the landscape, the larvae take advantage of that and migrate according to the moisture level until they reach the top of let's say, their highest object, which could be a rock, it could be a blade of grass, it could be a stick. When the heat starts to come out, namely when the sun shines and the moisture evaporates from the surrounding environment, the worms are forced to go back down into the soil to achieve a level of moisture equivalent to what they were used to on the blade of grass. And they can do this for some time before they run out of energy. And that depends, of course, on how far away from the fecal mass they crawled before they sought the highest environment in their environment. So all of this biology was learned by laboratory experiments, which tried to replicate some of these aspects. And a lot of hard work went into explaining exactly how hookworm carries out its life cycle. The major consequence of infection with Decatur americanus or Ancylostoma duodenale relates to two things. One, the amount of protein lost through blood sucking, and the amount of hemoglobin lost through blood sucking. The worm has a very clever strategy for, and I'm saying this anthropomorphically, of course, by evolution, the worm has been selected for life in which it has two cephalic glands, which it secretes anticoagulants from, which prevents the blood from clotting and allows the blood then to be sucked and to go down the entire length of the digestive tract of the worm. Let's see what some of these stages look like at various points in its life cycle, just to clarify. So we can initiate infections in dogs by using its own infection. It's called Ancylostoma caninum, and we'll return to that when we discuss creeping eruption, which is a consequence of exposure to the dog form of this hookworm. But we know a lot about this stage of the infection because there are lots of dogs and there are lots of people that work on this infection, and we've observed these larvae in the capillary next to the hair shaft many, many times. And so it's easy to get this view of the worm. It's not so easy to get the worm as it travels from, let's say, the skin into the blood and then into the liver, and then from the liver into the lungs. But we've already shown you some of that with regards to the life cycle of Ascaris. It looks basically the same for hookworm as well. So let's talk about how this worm causes disease. Sure, it sucks blood and feeds on villus tissue. And here we have a cross-section of a worm with its esophagus. It's a muscular esophagus that it uses to pump this blood out. And the mouth has these biting teeth or cutting plates, which it uses to grasp onto a villus and to chomp on it and actually twist, and it actually twists until it cuts it off. And then it swallows that. And that's what it uses for its food. The blood, in the meantime, continues to flow through the gut tract because of these cephalic glands. One is at this location. Though this might actually be one of those glands right here. And it's interesting because the anticoagulants that are found in hookworm secretions are much more potent than the anticoagulant, the single anticoagulant that's found in the medical leech. Hirudo medicinalis is the name of the medical leech, and it has a single component that blocks clotting at only one place. The anticoagulants of hookworm block clotting at two different places to make sure that it doesn't clot. So it must be using this blood for something critical, but we so far have been unable to derive from experiments just what's missing in the blood when it passes from the head end of the worm out the tail. What we do know, of course, is that that behavior creates anemia. It's not only the anemia that's created by the worm's action of pumping the blood, but after it finishes the villus tissue as its meal, it now needs to feed again, so it moves. And when it does, the anticoagulant is still in that place, and that continues to bleed for 2 or 3 days after the worm actually leaves that site and clumps onto another villus. So you have bleeding from the site of infection, we have bleeding from previous sites of infection. And with enough hookworms, you can honestly see how this infection could result in an anemia. Now, taking advantage of the fact that we know this worm produces anticoagulants has led to the concept that parasites aren't all bad. Some of them are better than others, and the reason why some are better than others is because of what they can do to us. That doesn't sound right, but it actually turns out to be the basis for an industry called parapharmacology. You can take substances produced by parasites and clone them, if they happen to be proteins or peptides, and you can use those for other medical applications totally unrelated to the parasitism itself. And this promises to open up doors that were in the past closed because we didn't have any chemotherapeutic agents that imitated exactly the immunosuppressive effects of a secretion product or the anticoagulatory effects of a secretion product from these large parasites. But we are now catching on to this, and we're trying to turn their swords into our plowshares. Now, Dr. Daniel Griffin is going to give a clinical vignette illustrating further the pathogenesis of this infection.
24-year-old female Peace Corps volunteer serving in Cameroon, teaching English and science in the local school. She's been in country for 5 months prior to developing this problem, becoming ill. First 3 months, she lived with a host family in their home and now has been in her own home in the community with electricity. She is 12 hours from Yaoundé, the capital. She is reporting intermittent diarrhea, loose stools, and abdominal discomfort. She has a history of walking barefoot, and lots of animals are present. So let's talk a little bit about clinical disease in hookworm. And we're going to break this down into 4 different presentations: dermatitis, pneumonia, abdominal pain, and chronic iron deficiency anemia. Now, clinical disease, dermatitis. The L3 hookworm larvae, these are the infective stage. They're going to penetrate unbroken skin with the aid of secreted enzymes that include a metalloprotease, a family of cysteine-rich secretory proteins, all known as the ankylostoma secreted proteins, or the ASPs. Now, repeated infection is going to result in an immediate hypersensitivity, and you're going to end up with this inflammatory dermatitis. Now, pneumonia. The larvae are going to go through a migration, as Dr. Despommier discussed when going through the life cycle. Now, when the larvae are migrating through the lungs, you can actually end up with pulmonary inflammation. You can develop a pneumonitis. During this stage, you can develop cough, dyspnea, trouble breathing, fever, peripheral eosinophilia, and this can all develop a week after exposure as the larvae are migrating through the lungs. Now, what about abdominal pain? Most patients do not report abdominal symptoms, but when they do, they're often quite vague. Bloating, colic, nausea, gas, poor appetite, maybe some diarrhea, and these can all occur during the early stages of infection as the worms are maturing in the small intestine. Later on, these symptoms will usually resolve. A lot of the symptoms that bring people in, as far as abdominal symptoms, are often due to concurrent infections. Now, what about chronic iron deficiency anemia? Now, this is really, I think, what got this parasite on the radar, so to speak. Most of the pathology of hookworm infection results from the presence of adult hookworms in the small intestine. The adult worms derive their nourishment from eating villus tissue. They also suck blood directly from their site of attachment. And the adult worms have this well-developed esophageal bulb that actually will pump blood from the capillary bed. The adult parasites also have the ability to secrete an anticoagulant. So when they move away from a site, you get a continued blood loss. And the amount of blood sucking depends upon which type of hookworm we're talking about. So the A. duodenale is going to suck about 0.1 to 0.02 milliliters of blood per day, so that's quite a bit, while our N. americanus, Necator americanus, it's going to be about 1/10 of that. Now, there are also going to be protein loss. You can end up with a protein malnutrition. And so in addition to the anemia, you can also have protein malnutrition, and you can have a pancreatic enzyme-based digestion interference, where you can also have a fat malabsorption. And all these can come together, creating consequent retardation of growth and development. Now, what about diagnosis? Microscopic identification of the characteristic eggs in the stool is still, and has been for some time, the way to make this diagnosis. You can't distinguish between the different hookworm species based purely on microscopy. The differentiation would have to be based on light microscopy by looking at the L3 larvae or recovering adult worms. But PCR tests have been developed, and these have really increased our sensitivity for making this diagnosis, and they themselves actually allow for species identification. But these are not in routine use in many parts of the world where the hookworm is endemic. This is a microscopic examination of feces, and this is showing us the characteristic egg. But what about treatment? Now, preferred, and you can get this in the US, albendazole, 400 milligrams just once. An alternative is mebendazole, This could be either the 100 milligrams twice a day, or you can just do a single 500 milligram dose. And again, over-the-counter parental palmoate can be given for 3 days as effective treatment. One of the drugs of choice here, we have mebendazole. Now, what about our patient? Now, in our patient, the stool was sent for microscopic examination. Both hookworm and ascaris eggs were seen. Patient was treated with mebendazole, and she reported several days later that she felt better, and she'll be screened again when she musters out of the P-score.
We've discussed a lot about control because, as I will allude to now, I will use a quote from a researcher that worked on hookworm and on other parasites too, an American parasitologist by the name of Asa Chandler, who was quoted as saying, "To prevent this hookworm, it is only necessary to prevent soil pollution with the feces of infected individuals." And that quote has lived on in the annals of sanitation. And indeed, it is the cornerstone for our modern sanitary approach to the control of lots of infectious diseases. The iteration that we are so fond of looking at now is the water treatment plant, but that also collects the feces from the population. So we've got both things going on at the same time. A little about the epidemiology of these infections. If I were to superimpose the word ascaris or hookworm, or not hookworm, rather, but trichuris on this graph, it would look exactly the same as it does for hookworm. You notice that there are very few people that have lots of worms and a lot of people that have very few worms. And so these are the people that we need to target and identify as the ones which contaminate the environment for all of these other people living in the same community. And we're getting better and better at doing that because, as I mentioned earlier on for the ascaris presentation, the genetics of why these people exist varies with each internal parasite because the control mechanisms vary with each of these parasites as well. Again, here's another place in the world to look, in this case, Africa. And indeed, the same kind of a curve is shown here as in other places as well, indicating the universality of this kind of a skewed relationship of a lot of people with very few worms and very few people with a lot of worms. Hookworm hasn't gone away. It's not going to go away unless we sanitize and maintain them. It requires vigilance at the community level, at the government level, at the individual level. Everybody has to cooperate in order for sanitation to work. There is a spin-off from this infection which relates to a zoonotic infection, which results in an aberrant infection in humans. It's called creeping eruption, and it's called creeping eruption for a very good reason, as I will show you in a moment. It's a dog parasite, and if you want to see a lot of dogs in one place and say, oh my gosh, they must have a lot of creeping eruption here, just go to Bhutan. Bhutan has probably more dogs than people. I was only there once, and the problem with Bhutan, visiting Bhutan at least, is trying to sleep at night when all the dogs are out barking. It's a common complaint of anybody who's ever traveled in this area. The country is beautiful, it's friendly, it's got lots of interesting things to see. But one of the things that's not so interesting to see are all these dogs just laying around. Apparently, nobody seems to own them. And they're all there because nobody bothers to collect them and put them in a place that, like a kennel. The Bhutanese religion does not allow these dogs to be sacrificed. And so they're allowed to live like everybody else, and they just tolerate them. Well, there's a consequence to this. This is one of them. This is the infective larva for Ancylostom echineum. Now, at some level, this is an absolutely beautiful worm. I mean, look at the symmetry of this organism. Look at the beauty of its internal organs. I mean, I'm speaking to you now as a nematologist that used to work on a worm. So obviously I'm attracted to them. But to be able to depict it in such a beautiful fashion attracts you to it for reasons other than the fact that it's a parasite. But this is the offending stage. This is the third stage larva, which then can penetrate the unbroken skin. And it does so in dogs as well as in people. If it does it in dogs, of course, the life cycle goes on and results in the production of adults. But if this occurs in people, here's what happens. We get something called creeping eruption, and we're not sure of where this worm actually started its life, although if you look at the intensity of the inflammation, the more intense the inflammation, the more likely it is that's where the worm is. And this is all resolved. So if we start up over here someplace where the worm actually penetrated the skin and migrated and continues to migrate in what's called a serpiginous lesion, one can end up with some very intense inflammatory responses. There may have been two worms. One ended up over here and another one ended up over here. You have no idea of how intense the inflammation is and the itching associated with it, but it often results in the creation of secondary lesions due to bacterial infections through scratching these until the itch goes away. Imagine now situations in which bathers on beaches are allowed to bring their dogs onto the beach. And this occurs throughout the world, so it's no problem finding pictures of dogs and people on beaches. Just go to Google Images and you'll see for yourself. But many of these areas do not allow dogs on the beach for this very reason, because dog feces is likely to contain the eggs of Ancylostoma caninum, and the beach then becomes contaminated. The sand is moist, the larvae hatch. You go to the beach, you sit down, and if your bathing suit is rather thin, and if you're only wearing the bottoms, let's say for males, or let's say it's a nude beach even, these worms have free access to us as well. And many a tourist has returned from private beaches where dogs are allowed and found themselves with these horrible lesions migrating across their skin in places like their thighs, on their backs. And the worst one I've ever seen was a woman who actually removed the top of her bathing suit to get a nice even tan on her back and laid down on the beach, and one of her breasts became involved and had so many tracks from so many larvae that it was difficult to know exactly how many worms she actually encountered. So what do you do about creeping eruption? And the answer is there is a treatment. There are many, of course, but one that seems to work out really well is to take thiobendazole, which is the parent drug for mebendazole, and apply it directly to the surface of the skin. And enough of the drug will actually get through to interfere with the biology of the parasite and kill it. You might also want to rub some cortisone ointment on the surface also to quell the itching, because, as I said, the itching itself can lead to secondary infection. Now, this is a big subject, and I've taken a lot of time with it, but there's a lot more to know. And obviously, included into the concept of how do parasites affect human behavior, here's a good review article in 2016 that talks about how much productivity throughout the world is lost by what are now being called neglected tropical diseases. And certainly these that we've just discussed, these nematode parasites, fall into that category. Of course, episode number 22 is another TWIP episode that features hookworm, and a lot of these stories are reiterated there in a slightly different way. I highly recommend you go look at that, microbe.tv/TWIP. So next time we'll discuss another worm that could have been called another geohelminth and part of the unholy trinity, but we didn't have a word for 4 of these things, so we just call it strongyloidiasis. Thanks very much for listening.